As we come to a lying down position, let's close our eyes. And I want you to take a moment to notice how you hold your head, your neck, and your shoulders. And I want you to notice specifically how you hold your head. Does it feel like it's tipped to one side more than the other? Do your eyes feel fairly level, or does one feel like it's tipped down more than the other? And bringing our awareness to our breath. Notice if it naturally began to move in and out through your nose and your belly, or did you have to place the effort into doing so? And we're just simply noticing. There's no judgment or no expectation. Just noticing if we built that pattern. And we're going to grab a hold of our therapy balls. Take one of them out of the bag. And then we're going to bend our knees. And we're going to start with our right side. So taking the therapy ball, we're going to place it underneath our traps between our shoulder blade and our spine, and then just set it there for a moment. Then we're going to take our right hand, place it on our left shoulder. So now we've lengthened those muscles between our shoulder blade and our spine, and we're starting up as high as we can go. And then I want you to relax. You don't have to lean into the ball very much at all. If you feel like you're leaning too much into the ball, lower your knees over to the left. I want this to be gentle, just offering a little bit of pressure through this area. Then we're going to take our right hand up to the ceiling, shortening those muscles, and then bringing our hand back to our left shoulder as we lengthen. Take our hand up to the ceiling on our inhale, and exhale, bring our hand down to our shoulder. Do that one more time. Reach our hand up and bring it back down to our shoulder and pause. You can adjust your weight by lifting your knees. If that's not enough, you can lean into the ball a little bit more. Then taking our weight off the ball, we're going to scoot ourselves up a little bit so that the ball moves down our shoulder blade. And I want you to just kind of wiggle around until you get it where you want it. It should be between the shoulder blade and your spine. Same things apply. Take your knees over to the left. Right hand's going to stay on your left shoulder. And you're only going to add as much pressure as feels comfortable. This should not be about how much pain we can take. Coming back to our breath. You may notice that your shoulder blade is pulling away from your spine, and that's okay. Reaching our right hand up to the ceiling and bring it back down. And maybe it doesn't make it all the way up, and that's okay. A couple more times, reaching up, bringing it back down. And then pausing and relaxing. And if you want a little bit more pressure, lift your knees, start to lean back in the ball, any one of those variations or both. And taking our knees back over to the left, lift our shoulder up off the ball, scoot yourself up a tiny bit more. And we should be down towards the base of our shoulder blade. And again, we're between the shoulder blade and the spine. Knees relax over to the left is where we start. Should be on soft tissue, not on the shoulder blade. And lean back to a place that's comfortable. And it could be a very simple, easy sensation that you're feeling. Nothing challenging, nothing difficult, nothing uncomfortable. Let it be just a little bit easier than what you're used to. Again, if it's too much, maybe tipping your head over to the left, finding any way you could take pressure off of that space if it's too much. Slowly reach our hand up towards the ceiling. Doesn't mean we get there, we're just going that direction. And bring it back down, bending your elbow. Place your hand on your shoulder. And 2 more times. And keeping our hand on our shoulder, we're going to let weight settle into this area if it feels good. Then come off the ball, rolling to our left side. We're going to scoot away from the ball and then pick it up and take it over to our other side. Starting at the top, let our knees come over to the right. Take the ball, place it at the top of our shoulder blade, between our shoulder blade and our spine. And then take our left hand to our right shoulder. And again, we're looking for that place that's almost comfortable. Just enough pressure that you know the ball's there, but nothing uncomfortable. Pausing, allowing the muscles to soften and relax while we keep our awareness on our breath and on the space around and near the therapy ball. Reaching our left hand up to the ceiling. Remember, it doesn't have to come all the way up. And then bring it back down to our shoulder. Bring it back up towards the ceiling and bring it back down towards our shoulder. One more time. Shortening the muscles and then lengthening our rhomboids. Then pause, allow everything to soften. If you want more, lift your knees up towards the ceiling. Roll back into the ball a little bit more. Any combination of those exercises, those movements. Roll off of the ball, scoot yourself up a little bit, roll back onto the ball, and you should be about mid shoulder blade. And again, a pressure that's comfortable for you. Left hand stays on your right shoulder. Letting our breath soothe our body. Reaching our left hand up towards the ceiling and bring it back down. A couple more times. Feeling the shoulder blade move on our back. Then pausing and relaxing. Completely surrender over the ball. Coming up off the ball, so we're rolling away from it. So we roll to our right side, inch yourself up a little bit, and then we're going to roll back onto the ball. Your place of comfort. Remembering your options for your knees, your head, your shoulders. No discomfort, no pain. Reaching our left hand up to the ceiling and bringing it back down. 2 more times, reaching our hand up, bringing it down. 1 more time. And bring it back down and hold. Softening even deeper into the ball. And slowly roll away from the ball. And then scoot away from the ball. And then we're going to reach around, grab a hold of the therapy ball, come onto our back, slice the ball off to the side, draw our knees into our chest, give them a hug. Let's rock side to side, moving through strength to the front of our body, noticing how our upper body feels. How does it feel to move through the shoulders a little bit as we just gently rock side to side? Creating a little bit of blood flow through this area. And then come back to center. We're going to come up to a seated position in any fashion you like. Once you find seated, I want you to either grab a seat on a block, a towel, whatever you have, and then scoot towards the front edge of whatever prop you have. And if you have maybe your mat you can roll up instead of using your block, that would work a little bit better because we're going to use our block for a different prop. So once you get to your seated position on the front edge of whatever you're using to help elevate hips up higher than your knees, and it doesn't have to be a lot, it's just enough that we can keep the natural curve of our low back. Then I want you to take the block in your hand, reach it directly out in front of you. Notice how this feels on your shoulders. We're going to reach the block up to the ceiling, making sure we're not moving it into any pain or discomfort. We're not pushing our head forward. Then bring the block forward, and as we bring it forward, we're going to lean back away from the block. Then we're going to come back up where our shoulders are over our hips, reach the block up to the ceiling. Reach the block forward, lean back, and bring the block up and lift our chest up. We're going to continue this flow. I'm going to show you a side version of the same thing. From neutral, hands come up, chest lifts maybe, finding a little bit of a back bend. Lean back as we bring the block down. Up and down. Go as far back as you feel comfortable. Let the focus be on the lift, on what it takes to lift our chest up and engage our mid back. Let's find one more time. Bringing the block to neutral, out in front of us, but keeping our shoulders upright. From our prop, we're going to take one hand, hold on to the block like you're holding on to a plate upside down. Well, the plate will be on top of your hand, but your hand will be underneath it. And then we're going to reach our hand out to the side, and then we're going to bring it forward. We're going to flip it over onto our other hand, take it out to the side. Bring it forward, flip it over, take it over to the other side. And continue to alternate sides. Hands are about the same height as your shoulders, but that doesn't mean that your elbows have to be. Elbows can be softly bent. They don't need to be rigid. We're allowing the arms to move in external rotation within our shoulders. We're also feeling the shoulder blades move on our back. So drawing closer to our spine as we draw it back. Feeling the front of our chest open. We're stretching across the front of our delts, front of our shoulders. The block is just a kinesthetic tool to help us understand how to move through our shoulders with success. Let's find one more time each side. And bringing the block down to the floor, place it off to the side, and then close our eyes. Notice how we hold our head. Check in that our elbows are underneath our shoulders. If our hands are out at our knees, then our elbows are probably going to be forward. See if you can pull the elbows back so that they're underneath your shoulders. Then come back to how we hold our head. Does it feel slightly turned to one side? Does it feel tipped at all? Is it a combination of being tipped to one side and rotated? And slowly lower our chin towards our throat. Keep lifting and lengthening our spine. Just allowing our head to tip forward and our chin to tuck. Then actively pull our chin in towards our throat a little bit more. Now we're stretching through the muscles along our spine, from the base of our head all the way down to about mid-back. And you'll feel this wherever you hold tension. Keep pulling our chin in towards our throat, finding our max range of motion. And then lifting our head up. Keeping our eyes closed, let's turn our head side to side. As we move side to side, notice any patterns that feel jerky, feel bumpy, feel crackly. See if you can slow down through those areas. And if that's your entire range of motion, that's okay. Bringing our head back to center. Keeping our eyes closed, notice, does our head still feel rotated, tipped, whatever direction that we found other than neutral, even the slightest bit. Then we're going to turn our head to the right halfway. Pull our chin down towards our throat. So still lifting and lengthening, letting our head tip forward at this angle. And then actively pulling our chin in towards our throat. Work with the strength of our neck. And you should be feeling this to the left side of your neck and shoulder. Top of your shoulder. Staying strong and active. And relax, slowly lifting our head up. Let's turn our head back to center. Notice how we feel in our head. Does it feel tipped, rotated, any combination of that? Bringing our head to the left halfway. Let our head tip forward. Actively pull our chin in towards our throat. Finding your full range of motion. And then I want you to pull a little bit more. See if that's actually your full range of motion. Don't push beyond anything that feels unnatural or painful or uncomfortable. Feeling the left side of our neck work while we stretch the right side of our neck a little bit towards the back and across the top of our right shoulder. And relax, lifting our head up. Bring our head back to center and again check in. Notice which one of these variations felt like it brought our head back to a neutral position, a place where our eyes feel level. You're going to have the option of doing whatever side felt the best. One more time. Lifting our spine, tucking our chin. And lifting our head back up. Returning our head back to neutral, keeping our eyes closed. And check in with how we're holding our head. Slowly turn our head side to side, keeping our eyes closed. Bringing our head back to center, let's actively pull our head back, like we're trying to get the back of our head to touch the wall behind us. Keeping our chin parallel to the ground, our nose pointing forward, spine lifting and lengthening, front of our ribs stay hugged in. And place one hand on our forehead, followed by the other. Holding your head in this place. See if you can soften your neck a little bit. And then actively press head into hand, hand into head. Should feel the front of our neck working. And then relax. Letting our hands come back down to our lap. Letting our neck and shoulders soften. And slowly turn our head side to side. Looking for smooth movement. Bringing our head back to center. Let's open our eyes. Place our hands on the front of our knees. Straighten our arms. Inhale, lift our spine up as tall as we can. Exhale, hinge from our hips. Keep a flat back. Bend your elbows. And exhale deeply through our mouth. Inhale, nice big, tall spine as we bring our chest back up. Exhale, breathe out through our mouth. Big sigh. Inhale, breathe through our nose. Exhale, let it go through our mouth. Inhale, nice big breath through our nose. Exhale, exhale, and sigh. Inhale, rise up. Continue to flow. One more time. Rise up. Let our hands relax in our lap. Close our eyes. Notice how we feel. Opening our eyes, we're going to set up for Shavasana. You can use therapy balls underneath your shoulders if you like. If you felt like you got a pretty intense massage to your shoulders at the beginning, I would advise you to not use the therapy balls underneath your chaps. You can support your knees, you can find a heart opener, you can make this any way you like it. Allowing our palms to face up, our shoulder blades to be flat on our back. Our head feels fairly neutral. Our eyes close. Our body feels supported. Drawing awareness back to our bodies. Letting our breath deepen. And I want you to fill your cheeks with air. Taking a nice big breath. Hold on to it in your mouth. Then I want you to take that puff of air and move it up into your right jaw. Using the muscles of your cheeks to push that breath up into your right jaw. See if you can get it all the way up towards your ear. Then move that puff of air into the front of your mouth and see if you can push it up into your upper lip. Then move it into your lower lip, maybe moving it side to side a little bit, stretching the muscles within our cheeks and around our mouth. We're going to take that same puff of air and move it into our left jaw, seeing how close we can get it to our ear. And let that puff of air go. Bend our knees. Let's roll over to our right side. Press ourselves up and find our way back to a comfortable seat. As we rise up tall, notice how we feel through our jaw, our mouth, our neck, top of our shoulders, our upper back. Taking everything we found in this practice, let's bring it between our hands as we bring them to heart center. Taking it all as a gift that we can move around with throughout the rest of our day and the days to come. Namaste.